This is Anna, and this is her baby Marco, who is now 4 months old. Marco was born earlier than expected, and there were some complications at birth, for which she had to go to the intensive care. Marco had follow-up appointments at the doctor. Anna is very worried about the health and the development of Marco. She does not know what to expect. We like to pay more attention to babies like Marco that are complications during birth, because they might develop problems with movement, also called neuromotor dysfunction. The most common neuromotor dysfunction in childhood is cerebral palsy, or CP. CP is a movement and posture disorder occurring due to damage to the brain before or during childbirth. Events that we like to pay more attention to are those occurring before, during, or after childbirth, as they might make the chance of CP higher. For example, when the baby is born too early, had birth defects, or had an infection during pregnancy. Events after the childbirth that might raise concern are stroke, infection, and brain injury, occurring before the age of 2 years old. However, it is important to know that having one or more of these risk factors does not mean that your child will have CP. In fact, in about half of the cases of CP, there are no evident risk factors at all. This is Paola and her child Francesco, who is 10 months old. Paola is concerned about Francesco's development. She has noticed that Francesco is still not able to sit independently, and he always uses the same hand to grasp or reach for his toys. She doesn't know what to do because she is not sure whether this is normal or not. Parents who are concerned about the development of their babies should visit the doctor to ask for more information. At the doctor, children like Marco and Francesco will be neurologically examined and the quality of movement assessed. The doctor will look if the way they move is less complex or different than the typical movements of children their age. Sitting, rolling, crawling, standing, or stepping are some examples of what the doctors look at. Magnetic resonance imaging, or MRI, may then be made, which makes a picture of the brain in a safe manner. When the diagnosis is unclear, or if it is certainly not CP, testing will continue if needed to find possible explanations of the impairments. If it is sure or very likely that the baby has CP, the type will be determined. This entails which part of the body is mostly affected, either one side of the body, just the legs, or both arms and legs. Children with CP can achieve a range of abilities in later childhood. Some will be able to walk and talk, but in other cases, children might not be able to walk, have to use a communication device for talking, or need extra help at school with some tasks. But this does not mean that their opportunities in life are limited, just that they may need more time and help achieving their goals. Doctors will also look if there are other associated problems such as impaired vision, or hearing, or even sleeping and behavioral problems. This procedure will likely take several visits to several specialists. After this, the medical team will tell what was found, and parents can ask everything they want. The doctors will also tell parents what will happen next, what therapy is appropriate, and what parents can do to support and motivate their child. This way, Marco and Francesco will be able to live their life to the fullest.